It's really my pleasure to be here. Maria, years ago, said, I'm going to bring you to Argentina, and she came through with her promise, so it's very nice to be invited and to make it. The strike doesn't bother me. There, in fact, is a strike at Johns Hopkins Hospital today, so I can't escape it. Janitors and staff and some nurses, too. So there's strikes everywhere. But it's really nice to be here and to be invited. This is the first of 4 talks, so hopefully if you like today's talk, you'll come back tomorrow for the other 3. What Maria asked me to cover first in today's talk was a little bit of the history, just to kind of get you interested and excited as to where the diet is today. It's really important to know where it came from, and it's actually a very interesting history. Hopefully, I'll convince you of that. So we'll go ahead and start a little bit before I discuss the diet. Who's been to Baltimore before? Not enough, not enough. This is Baltimore. So this is Camden Yards. This is where the Baltimore Orioles play baseball, or at least they try to play baseball. They're better this year than they have been before, but still not as good as the Yankees. This is what most people think of when they hear of Baltimore. This is the Inner Harbor. So Baltimore is on the Chesapeake Bay. Lots of boats, lots of seafood. The most famous seafood is Baltimore Crabs, either in crab cakes or here, a little bit messy to rip open and eat, usually in our summertime, which is actually, we're coming into crab season. This is what I do most of my free time when I'm not in the hospital or emailing Maria. I'm riding my bicycle. Baltimore is a very small city in American standards, but has a lot of wonderful countryside all around it for fun biking. And so hopefully, if the weather holds out, I'll get a little bit of time biking in Buenos Aires on Saturday. One of my favorite things to do. This is Johns Hopkins Hospital. Like Hospital Italiano, it has a lot of history. Actually, a lot of similarities in the architecture, too, in the main lobby when I had a tour earlier today. It's been around for about 150 years. This is the oldest part of the hospital. No doctors allowed, essentially. Mostly administrators and lawyers and the president of the hospital. We can walk through, but then they usher us out. This is the main part of the hospital now, which was just built and finished about 2 years ago. This over here is, This over here is the Children's Hospital, and then behind it are 2 towers of the adult tower. And I like to show this in a way as I talk about the history of the diet, because we've come a long way in the hospital, but also the ketogenic diet has come a long way. And so I'm going to take you through a very long but interesting history for where the diet has really come become a popular therapy. Most people believe who have studied the diet that probably the first reference to using a diet of any kind or using food to help seizures goes back to probably Hippocrates in 400 BC. There are references in some of his writings to a man who had epilepsy such that he actually fell into a fire and had burns from the fire from a result of a seizure, which sadly still happens today to patients with epilepsy. And so they didn't know what it was, but they knew he had convulsions. And back then they thought epilepsy was an excess of excitement or sometimes sins that were causing it. So what was prescribed, and you'll see this come up a few times, was abstinence, sort of stopping things that you were doing that might be causing the seizures to happen. And so back in 400 BC, Hippocrates thought that maybe certain foods were causing the seizures. And so they recommended food and water for periods of time to be stopped. And it worked. Okay? And we go back and look, and it's not surprising that it actually did stop the seizures. We'll talk about fasting and what we've learned about that a little bit tomorrow, actually. Then about 200 years later, in the writings of Galen in 200 BC, they continued to talk about this. Recommended abstinence, in this case, was really first about specific foods. Not necessarily the high carbohydrate foods that we'll talk about on the ketogenic diet. They just recommended not eating meats, not drinking wine, lots of different foods and things. But this was probably the first reference to changing your diet, whereas back Hippocrates said just completely no food for periods of time. Many people believe, and parents, when they read about the diet, that this was where it started, but again, it was probably 400 years earlier. But at least in the Bible, there's references to what sounds like a case of childhood onset epilepsy that continued into an adult. And so this, in the reference in the Bible in Mark 9, they talk about a patient who fell on the ground and had what appeared to have been a seizure. And then Jesus asked the father of the child, who was actually a young adult in his 20s at the time, and he said this started during childhood. So again, probably a childhood onset epilepsy of some form. We obviously don't know why. Maybe it was trauma or some other reason. And what Jesus did was said prayer and fasting, similar to what had been described for about 400 years before. And then the patient was cured of his affliction. So this often comes up when you read about the ketogenic diet, that it has references in the Bible. But again, there's probably 400 years before that. Not a whole lot for the next 1,200 years, sort of the Dark Ages, so to speak. And then there was a little bit of some reference in the 12th century in the writings of Maimonides, where he talked about using diet as a therapy for all kinds of medical illnesses. And he felt very strongly, as they were coming up with different compounds that could be used in a way like our modern pharmaceuticals, that first you should be trying diet. And so an interesting concept back in the 12th century, which may now start to be for certain kinds of epilepsy that we're treating with the ketogenic diet, coming to be true now today, where there are some epilepsies we're using the diet much sooner, if not first. And so this quote is often on a lot of websites of parents of the ketogenic diet who say, this is not a new idea to use the diet before medications, but people think it's a brand new idea. For the next 600 years, there were some intermittent uses of water diets, patients who would stop eating but would drink water for sometimes up to 3 or 4 weeks at a time, some very long periods of time with no food. They were using this a lot in France. There were some articles that were written sort of in the late 1800s in France about water diets being helpful. And then it was really about 1910, 1911, really the most large articles were written about fasting diets. And you can see here, it actually made the news in the United States when they heard about what was going on in France and then later in some of the northern states in the United States, where they would put patients with epilepsy on fasting diets. Usually they were not going to medical doctors. They were going to more healing osteopathic doctors. But for some reason, this worked. And they said, this is a great idea. This is a potentially great therapy. But you can't stay on it forever. Obviously, you're going to get into big trouble if you don't eat for periods of time. We talk now, and we still do fasts, often traditionally, to start the ketogenic diet. When I was in training, it was about 72 hours. It shifted to 48 hours. Now at our hospital, it's essentially 24 hours. But you look back at what they were doing about 100 years ago, this is sort of when they would stop. So it would sometimes go on for a week or two. So I tell my parents today that this is nothing. 1 day is nothing compared to 100 years ago, because they complain, as they always do. This was at a time there weren't many other medical treatments for epilepsy. There was phenobarbital, there was bromides. So when this came out, the concept of fasting and intermittent water diets, a lot of patients looked to them as potentially helpful. And so they were moderately popular at the time. But there was, again, no real specific diet at the time. 1921, we'll talk about a few key dates in history, was probably the most important key date in the history of the ketogenic diet. In fact, the 2 articles that came out about it were really 1.5 to 2 months apart. The first article in June 1921 from Galen was really the largest series talking about fasting. It was published in this journal here, the Medical Record, June 11th, 1921, and talked about a large experience using fasting and water diets for epilepsy. And this was the first in the English language literature talking about this therapy for epilepsy. 1 month later, Dr. Wilder, who actually had some history as an endocrinologist, but then did some neurology work from the Mayo Clinic in Rochester, Minnesota, first created the ketogenic diet. So we're getting close to the 100-year anniversary. It's now 93 years. And so Dr. Wilder at the Mayo Clinic created this diet basically from what he knew about metabolism. He knew that patients who had diabetes, if they were ketotic, it was similar to a starvation state. And he theorized that a high-fat, low-carbohydrate diet could do the same thing, that it would mimic what the body thought was a starvation state, but you could give calories and continue it indefinitely. unlike the water diets, which people knew you had to stop after a few weeks. And so when this came out in July 1921, this was extremely popular, and in many ways is still very similar to the ketogenic diet today, as far as a 90% fat diet with most of what's left being protein. When this came out, there was very little else out for epilepsy, so it was very popular. What changed was really in the 1940s through 1960s, medications started to come on the market. It's fascinating if you go back and look at some of the advertisements for these medications back in the 1940s. This was one of the earliest advertisements for phenytoin or Dilantin, okay? And they sort of imply that now you can do something, as if you couldn't do anything before. A little bit of a slap in the face of the diet. But you see these ads, and it's sort of like, why would you ever do a diet when you have a miracle pill? And so when this started happening, the diet was often perceived as intolerable. Some articles saying it was expensive, unnecessary would come out in review articles. It was very sad, but it basically became unpopular because the medications became more popular. One thing that's really neat, have any of you guys heard of Google Books? It's a great website. It's a relatively new website through Google where you can do a search for any one word and find out in all the published literature, not review articles, not the medical literature, but books, what % of the books that were published at that time had that word in it. So you can see trends of things over time in a very unique way. And so here you can see very small percentages, but still, okay? And from 1900 all the way here to 1990, you can see the ketogenic diet was invented here in 1921. Okay, there were some articles a little bit before that, some books, and then became very popular until about 1940 when these medicines started coming on the market, and then it plummeted very, very, very quickly and really kind of continued to decline as new medications came on the market. So a little bit of a proof in some way of what we knew has happened in terms of the initial popularity and then the later decline. In the early 1990s, the ketogenic diet was in a very sad, sorry place. There was really no medical publications in the last 20, 30 years. The largest ones that were out, one was from Ruby Schwartz in London, had 55 patients, a respectable number. That was in 1989, looking actually at the MCT diet. And then Steve Kinsman, who was at the time a resident at Johns Hopkins, along with Dr. Freeman, published some results in 1992 of 29 patients. But at the time, that was really about it. Very few articles were being published. In 1996, there was a review talking about what they considered alternative epilepsy therapies. Number one was the ketogenic diet. And today, we really don't consider this an alternative therapy. It is not a healthy, holistic, organic therapy, as we tell parents. But at the time, in 1996, it was, in that article, relegated to an alternative therapy. In fact, in 1995, this article came out with the title of sort of Fat or Fiction, kind of, again, implying that the diet really may not have a whole lot of scientific basis. So in the 1990s, it was not very well used. There were a few centers, including ours at Johns Hopkins, who were using the diet, but really no more than about a dozen, and really only in children who failed every different therapy out there. It was considered, for the most part, again, alternative medicine. By sort of 1995, and that was when it changed, there were no posters, had never been a poster on the ketogenic diet, not even talk about an article, but even a poster at the American Epilepsy Society, and most neurologists were not encouraging it. And so this was only 20 years ago, and we'll talk about how dramatic things have changed. There we go. The next sort of big date in history was November 17th, 1993. What happened on that day was a young boy named Charlie Abrahams was admitted to Johns Hopkins. This is what Charlie looked like at the time. He was about 18 months old. Charlie had failed about 5 different medicines. He had had a partial corpus callosotomy in Los Angeles, where he was from. And Charlie was obviously not responding to therapies, having many seizures per day. His father went into the library of the hospital, read about the ketogenic diet and at the time, about 70 years worth of history, but was told that it doesn't work, was told it was too hard to do. And so his father contacted my predecessor, Dr. John Freeman, who said, yes, we're doing it at Hopkins. You have a choice, and this is actually a true story. For those of you who know Charlie Foundation and Jim, he basically said, you can either come to Hopkins and we can do the ketogenic diet, Or you can go see, there's a faith healer in Houston, this is what Dr. Freeman was told, that had agreed to see Charlie and try different herbs and different therapies. And so I talked to Jim and I said, oh, so you came to Hopkins? He's like, no, actually we went to Houston. I didn't know that. And he said, didn't work. So then we came to Hopkins. Anyway, so November 17th, he was admitted at Hopkins. His seizures were unable to be controlled. He was admitted for about 5 days, and when you go back and read his discharge summary, by generally about day 3, day 4, his seizures stopped, and they never came back. His father was angry that basically he had to try all these things and had not been told about the diet. Looking back, I suspect that probably Charlie had myoclonic astatic epilepsy is my guess, but we don't know for sure. This was about 20 years ago. But his father first did something that really got the attention, was to get a program on Dateline NBC. So you can actually watch it on YouTube nowadays, and talked about the diet, and the phone calls started coming and patients became very interested. The next year, they put a movie together called First Do No Harm with Meryl Streep about the ketogenic diet. Charlie's father, for as many of you know, is a Hollywood movie producer. And so not a bad thing to have in a parent support group, to have a father who is so involved in the movie community. And so this made a huge impact on the community, lots of families interested. But also he did a very nice job of saying, you know, I don't just want to get the word out about the diet, I want research to happen. And so he funded several different studies with the Charlie Foundation, which was formed in 1994. And if you look at pretty much anything that's happened, that was the turning point. If you look at the number of posters at American Epilepsy Society, not a big surprise, nothing, 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 nothing. And then 1996, there were actually 6 posters, just mostly from research that the Charlie Foundation helped fund. And then things have kind of consistently taken off. And now there's generally about 10 to 15 posters per year at the American Epilepsy Society, usually very well-attended posters. If you look at published articles, again, not a big surprise. There were a few articles over the years, but then 1994, things have radically taken off in terms of published articles, not just abstracts. Many of these are very good articles. As you can see here, sorry, maybe a little small print, but some are prospective, some are retrospective, some as high as 150, here 230 patients, 140, for as long as sometimes up to 2 or 3 years of follow-up. They're not just short-term studies. But one thing that was a problem, at least perceived as a problem by a lot of the medical community, is if you look at this last column, this was a meta-analysis that was published back in 2006. There was a lack of any sort of grade 1 or grade 2 evidence. Almost all of these papers were single site. They were open label, so everybody would go on the diet. So there was really no control group. So patients would ask about that, and the doctors would sometimes say to the patients, yes, well, there's no controlled studies that show it worked. And so in 2006, this was perceived as a little bit of a problem. And so 2008 was a big turning point for a few reasons. The first big turning point was we had our very first ketogenic diet conference. Maria was there. This was in Phoenix, Arizona. It didn't hurt that it was beautiful weather. The sky looked like this every day, and it was beautiful temperatures. Everybody was outside. But this was wonderful. This was actually the first ketogenic diet conference. We've had a few since. I'll show you. But this was pretty amazing to think about. Okay, here we had about 300 people coming just to hear about the ketogenic diet, where maybe only about 13 years before, there had never been a poster at the American Epilepsy Society. So, wow, what a big change. The other thing that happened in 2008, that very same year, is we put together what we call the expert consensus statement, where we had 26 specialists, including about half were dietitians from all over the world, where we said, what's maybe what the evidence would now suggest, since we have so many publications now, what can we say about the best way to do the diet, or at least areas where maybe we have no idea what the best way to do it is. And so this came out in 2008. We'll likely revise this in the next few years. But I think when this came out, it really not only helped centers to say this is maybe a good idea of what to follow, but I think it showed what we don't know, and a lot of the questions raised in this consensus have now been studied and researched. So a very good secondary gain from doing this consensus statement. The other thing that changed in 2008 were, as a result of not having controlled evidence, in 2008, 2 articles were published that did have controlled evidence for showing that the diet was helpful. The first, and probably the most famous, was from Liz Neal and Helen Cross. That was done out of Great Ormond Street. And I'll show you a little bit more about that in the next slide. The second one was actually done at our center, which actually had a blinded arm. So in this arm, this was for children with Lennox-Gastaut syndrome. Children were randomized to either start the diet or to start the diet with a solution of glucose. Seemingly, the idea would then be the glucose would counteract the diet, and that would be a placebo arm. It was close to significant, but not quite. Probably not enough glucose was given, and that the fast was so powerful that almost everybody in the study got better. So there wasn't a statistical difference between the 2 groups. But it did show that you could do a study of the diet with a blind. Okay, people said that's impossible to do. One child's eating butter and bacon and eggs, and one child's eating normal foods. So you can actually get around that with different ways. So the Great Ormond Street British study that was in 2008 has gotten probably the most citations out of any article that's ever been published on the ketogenic diet. This was done by using a control arm of basically continuing medications as usual. So it wasn't technically medicine versus diet. It was sort of continued care versus diet. But still, it was a control arm. And in this study, everybody had to wait 4 weeks, okay, all the children. But then half the children started either the MCT or the classic diet, sort of a different sort of randomization, or they had to wait an additional 12 weeks to start the diet. So basically it was a study evaluating starting the diet at 4 weeks versus starting the diet at 16 weeks. And their hypothesis was that the ones who started at 16 weeks would not be doing as well as the ones who started right away. And what they found was that was the case. When you look at those children who started the diet right away, 38% had a responder rate, generally a little lower than what we usually see. Most of the time in studies now we see about a 50% having a responder rate. This was a little bit lower. But when you look at the control groups who just continued doing what they're doing, it was only 6%. And so this was highly statistically significant. When you look at those who had a greater than 90% reduction in seizures, 5 out of 72 had this with the diet versus not a single one of the control groups had that kind of an improvement just spontaneously. When you look at it in a different way in terms of baseline number of seizures, the children who had controls who did not start the diet, if anything, had more seizures by doing nothing, whereas those on the diet had a significant drop in their seizures. So this was published in 2008. Again, it's gotten a lot of media attention, a lot of attraction, saying now we actually have a study that has proven with a control that the diet works. Their excitement continues. In 2010, we had another meeting, and we've been having these about every 2 years. This was done in Edinburgh, so we kind of jumped the Atlantic Ocean to the British side. This was a very good meeting with even better Scotch whiskey. We then had another meeting just 2 years ago in Chicago. And the theme of this meeting was actually very different than the other 2 in terms of bringing together, and I'll show you a little bit of this later, some of the people in the world who are using diets for things other than epilepsy, which is rapidly growing in just really the last 5 or 6 years. So we had specialists here that were specialists in obesity, Alzheimer's, autism, brain tumors.